Hi guys, my name is Vanessa Flores. I am a current student at San Jacinto College. I am in the nursing program. I'm so happy and so proud to say that I am on my second semester, about to be halfway done. But I absolutely do want to thank you, and I am absolutely blessed to say just how important this is, how important it is to just to be able to grant somebody this scholarship, and just to be able to express how passionate we are about something. And my passion has always been nursing. Nursing can always and always has and always will, I think, incorporate just a lot of good value, a lot of good information towards that STEM field. I've always said, just a little background. My mom, when I was in her womb, everyone says, oh, you transmitted that to her, because she would always say, oh, this little girl right here, she's going to be a doctor, nurse practitioner, nurse. She's going to be somebody good that she's going to be able to help one day, right when they need it, when they need it the most. And, just being a little girl, I always just grabbed my doctor's aid kits, my first aid kits, my stethoscopes, my little injections. I would just go around and just apply a band-aid to somebody just because. But ever since then, I've always prayed about it, and I've told God, place me where you need me to be, and where I'll be your tool, and I'll be used. And He's absolutely just led me right down the right path, I feel. Enough about that, but the STEM field stands for science, technology, engineering, and math. The science, people always say, oh, we could be half good at science, and some people are half good at art and reading. Science does incorporate, we do study from head to toe, to front to back, to inside and out. As nurses and being in the health field, you have to know just exactly what's going on with your patient, what we're going to do for that patient, what we have to teach them, what's the next step, and what is it that they're going to do, and when we're not there, when we're not be able to be there. And that's why, at the same time, I think that art has a lot to do with it, because I always say the art of the heart. But people are there at the hospital, or people are there at their homes, and they're not feeling their best, they're not doing too good. They're stressed about financial issues, what the doctors might say, what they're going to do about it with their families. But it's just always having that open communication, that therapeutic communication with that patient, being able to express their concerns and ask questions, and we're able to answer them. And if not, we'll be able to, more than glad to find out what that answer is to that question that they're just absolutely having troubles with. Technology, there's always new, just evidence-based practice that we do research, we do documentation on the computers, just our head-to-toe assessment, because one moment the patient could be fine, and absolutely, the next minute everything could change, dramatically and drastically. So we have to be able to always, just be familiar with the new equipment. And every hospital has different protocol, different policy that we have to learn, and so we have to be lifetime learners, and be able to be open and sensitive to everybody's culture and everybody's background. As well, for engineering, we're always gearing our minds. We're always saying, all right, what are we going to do? What kind of care plan am I going to perform for my patient? What is the goal for today? Are we pain managing? Are we teaching that patient what to do? What's the safety protocol? So they'll be able to finally be on their own after they get out of that situation. Also, you have to gear that patient's mind. You have to be able to talk to them and say, all right, what are your concerns? What is your objective? What is your goal? Right? It just can't be one-sided. It's a two-way road. And, as patients, we always want to be able to comply with that other person. What is it, what can I help you with? Always be offering and be willing to just be that lending hand. For mathematics, you have a doctor's order, and you have what you have available from the pharmacy. So you have to be able to calculate your dosages for whether it be a child or whether it be an adult. And it could be IV medication, intramuscular, subcutaneous, which being the fat tissue. It could be oral, it could be rectal. So you have to be able to calculate and think about, how can this affect my patient? And think about, okay, well, I don't want to overdose, and I don't overdose my patient. I don't want to underdose my patient, right? So there's so many things that go into play, but nursing just absolutely has been the most amazing thing and the most absolutely interesting. And, it just has so much to play and so much to still figure out. Like I said, we're lifelong time learners, and there's something that still is out there to get us and still out there that we're able to help other people. We're still able to guide and teach and learn from other people. And I think that's such a big thing. Thank you guys.